lockdown after the first 3 weeks before the United Kingdom government. He's also now published, as you're probably aware, proposals for relaxing the restrictions of lockdown. In fact, he's come up with a traffic light system that is again peculiar to Wales and is not prevailing in the rest of the country. Do you not think that that is causing some confusion?
Well, my own preference, strong preference, is that there should be unified communication. But I respect the right of the First Minister of Wales to communicate the Welsh government's approach in his own way. The thing about the document that the Welsh government produced was that it wasn't that different in overall tone and detail from what the UK government had said. But people like yourself and so on will draw their own conclusions about the appropriateness of the way in which it was communicated.
And in terms of the army, whose role is becoming increasingly prominent in this crisis, if one of the devolved administrations seeks the assistance of the army, I think that there have been 6 requests from the Welsh government for army assistance. How is that arranged and how is that authorised?
Well, it is the case that any request for military assistance to the civil administration has been expedited. It goes to the MOD. The MOD are only too happy to help, and it's been the MOD who've been, well, on one hand, it is the case that there are members of the military who are currently in the Department of Health helping to coordinate the delivery of testing, and it is also the case that it is members of the military who are responsible for ensuring that the various mobile testing centres that we have around the country can visit care homes and ensure that people are tested in numbers. That wouldn't have been possible without the British Army, the Royal Navy, the Royal Air Force and their personnel. And like you, my respect for the armed forces has only increased. Their capacity to manage logistics, to think around corners, to deliver is peerless, and we are very, very lucky to have them.
Thank you.
Thank you. Jackie Doyle-Price, followed by John Stevenson, please.
Thank you, Chairman. One of my bugbears is London-centric policy making. And as you mentioned earlier in your evidence, clearly the disease has spread far more quickly in densely occupied urban areas like London, Birmingham in particular. Can I ask to what extent it was considered in implementing the lockdown, whether it should be done on a more regional basis? Bearing in mind there'll be some communities where actually the incidence is very small, and we do have hospitals in the north of England which are now full of empty beds.
It was the case at the beginning of the discussion about the lockdown. It was the case that one or two people put forward the idea that it should be London specific for all the reasons that we know. But the point was made, well, it'll be difficult to police. If you say that someone has to observe social distancing rules and can't go to the pub in Kingston, what happens if they go over the River Thames and go to the pub in Surrey? It becomes difficult to manage. It was felt that it was appropriate to do it on a nationwide basis. And I think it has been effective because we have seen the virus spread, and there have been flashpoints and outbreaks across the United Kingdom that have been worrying and concerning. But I do agree with you. It is often the case that because of where our politics takes place and because of where our media are, that we sometimes have London-centric policy thinking. One area where we may be able to explore having the lockdown eased more would be in island communities. And Bob Seeley, the MP for the Isle of Wight, has suggested that we may trial contact tracing on the Isle of Wight before it's rolled out nationwide. And if we do that, we might be able to use the Isle of Wight as an opportunity to see how we can relax those measures. And I think similar suggestions have been made by some of the island communities in Scotland, but obviously that's a matter for the Scottish Government.
But I think there's an issue here as well with regard to messaging, and it's similar to the ones that my colleagues representing Scotland and Wales have raised, because clearly the lockdown applied to if you can work from home, please do, but you can still go out to work. Whilst at the same time, the Mayor of London was becoming very agitated about construction workers still travelling to work and using the public transport system. But clearly, from an economic perspective, we still needed that activity to go on. So do you see a tension also with the leaders of devolved local government in terms of ensuring consistency of messaging?
I don't see that tension yet, but I think you make a fair point. And again, one of the things is that outside London, and certainly outside major metropolitan areas, the overwhelming number of journeys to work are done by car and van, not by public transport. And I think that that sometimes that is forgotten in some of the discussions, just because it may be the case that that MPs or national media journalists are using public transport in London. They assume that that is the normal for everyone, and it's not. And when we've been looking at ways in which we might potentially ease the lockdown, the point has been very forcibly made. Yes, it is important to think hard about public transport in London and in the West Midlands and elsewhere, but it's also important to recognise that most people in the rest of the country don't use public transport to get to work, and that we should think about policy in that way as well.
Well, I'm glad to hear that, actually, because it's abundantly clear that probably the worst place to enforce social distancing is public transport system. And the dependence in London is quite unique. But obviously, the most important thing we've got looking ahead is to make sure that we do get the economy back on track as soon as possible. So I guess my plea to you is that when we come to look at easing the lockdown, can we have a real attention paid to public transport and a real attention paid to making sure that those people who can work are getting that message loud and clear, and that it's tolerated by everyone else? Because I don't know about you, but I'm getting rather frustrated by my neighbours who tut about people getting in their white van to go to work every morning, but quite happily take the delivery from Amazon for their latest delivery. And I think there needs to be a bit more understanding on the point of view of the pointy elbow middle classes of what the workers have to do to earn a living.
I agree 100%.
Marvellous.
Thank you. Briefly before John Stevenson, sorry, a supplementary from David Mundell.
I'd like to return to the issue of potential regional or indeed national variations in the lockdown. I know that you're a keen follower of the Scottish social media scene, and there's been quite a lot of excitement in that environment about the potential for regional or national variations in lifting the lockdown. Now, I mean, obviously, if the scientific evidence promoted such a view as to be a basis for easing out of the lockdown, it's obvious to me that that's something that could be contemplated. And I just wanted to be clear where the UK government stands on that issue, that it would contemplate such a regional variation. I was pleased to hear the First Secretary describe the Scottish Government's paper, which they had produced last week, as sensible, because indeed that's what it was, because like the Welsh comparison you made, actually it was almost entirely predicated on the UK government's 5 tests. But could you just confirm that you could contemplate that there could be some form of regional or national lifting of the lockdown?
Thanks, David. I agree with you and the First Secretary that the Scottish Government's document was sensible, and I read it with interest in it. And you're absolutely right; it broadly reflected the policy the UK government has been following. On the area, on the question of regional variation, this is something that they're talking about in France at the moment as well. My own personal view is that it's preferable if we do it as one United Kingdom, but there is a specific scientific justification for saying that island communities can be areas where you could pilot some measures, contact tracing in particular, in order to combine that with relaxing measures at a progressively greater rate, and that can help you judge what is right for the country overall. So, as I say, different European countries are adopting regional variation. My belief is that overall it's better if we do it as one United Kingdom, but there are specific opportunities in island communities to conduct trials.
I mean, it certainly would be better, as you would appreciate, to have a one United Kingdom approach for my constituency, which is on the border, and people still are travelling to Carlisle, for example, to work in the NHS. It would seem to be ludicrous that there would be different rules applying to them at home as to in their place of work.
Yes, I mean, it would be odd if the political editor for Border TV had to observe different rules depending on whether or not he was reporting from Langham or from Carlisle. Exactly.
Thank you. John Stevenson, followed by Lloyd Russell-Moyle.
Thank you, Chair. Michael, at the beginning you said all aspects of the Constitution are working well together. One part of our constitutional system is local government. How have local government leaders been involved in decisions about the UK response to COVID-19?
Thank you, John. The Secretary of State at MHCLG, Robert Jenrick, and his junior ministers, Chris Pincher and Simon Clarke, are regularly in touch with local government leaders in order to make sure that they understand the strains and pressures that they have. And it is the case that the role of local resilience forums has become even more important, obviously, in dealing with this crisis. And they are in regular touch, as is the Cabinet Office, with the people involved in manning and operating local resilience forums. One of the things that Simon Clarke has done is that he's asked all government departments for recommendations for areas where there are burdens currently on local authorities that we can lift in order to allow them to concentrate on the particular challenges of the emergency.
Interestingly enough, the devolved administrations have been involved with the national government quite regularly, as has the Mayor of London. Do you think other metro mayors and possibly some sort of representation from the rural parts of England should have also had greater representation?
It's a fair point. I think you're right that metro mayors, Andy Street, Andy Burnham, Ben Houchin, have a very important role to play. And I know that the MHCLG team have been in touch with them. And I was able to talk to Andy Street a couple of weeks ago about a specific issue where I hope that we would be able to help. But you're also right to raise some of the particular questions that face rural communities. And those concerns are reflected by different ministers. But one of the things I will talk to both George Eustace and Robert Jenrick about is how we can make sure that when we're thinking things through, that we're properly rural-proofing our response.
Thank you. In addition, what mechanisms are in place to ensure that the various local authorities have access to, say, scientific advice, which they need to use to fulfill their role in emergency planning, dealing with the pandemic, and obviously social services? So what advice are they getting, and how easy is it?
Well, the Civil Contingency Secretariat has a good relationship with local resilience forums and shares material with them. And that should ensure that whoever the goal commander is for any local resilience forum and whoever his or her partners are, have access to the best contemporary evidence. And obviously, when it comes to some of the services that local government are providing at the moment, we're discussing with them everything from what might be a safe way for schools to return and what might be some of the additional PPE requirements that people delivering public services might have.
And do you think that's a two-way process, in that quite clearly local government will have their own experiences, there are clear regional variations, and they will be feeding back into central government? Is that a response from central government in response to the feedback of information?
I think it is. And let me take one very challenging area. One of the concerns that people have had throughout the pandemic is that the increased number of deaths would place particular strain on funeral management and everything associated with that. And we've been talking to local authorities about that issue, and their response has informed everything that we're doing. There's a dashboard of the local capacity that local authorities and local resilience fora have, and that helps us because local authorities feed back information about particular areas where central government can help them to discharge their responsibilities.
During this pandemic, there's quite clearly a number of organisations who are involved and have responsibilities. Do you think it is clear who has responsibility for what between central government, the both administrations, Public Health England, NHS England, local authorities? Is that clear and transparent and obvious?
I think it is, but obviously, if it's the case that you, your constituents, or others feel that there is any uncertainty, then obviously we'd want to respond to that. I mean, the one thing I would say is that all of us as MPs know that sometimes there can be, in the minds of some of our residents, uncertainty about whether or not something is the responsibility of the borough council or the county council. So it may well be the case that for people leading busy lives, the distinction between Public Health England and the NHS may be one that they wouldn't ordinarily want to scrutinise closely, but in a pandemic situation, of course, it becomes critical that we know who is delivering what. And I think that is clear, but if for any reason there are any difficulties that people are encountering, then the more we know, the clearer we can be in reinforcing those lines of accountability.
On that point, where do you think issues have arisen?
In terms of potential confusion?
Yes, and lines of responsibility. Where have issues arisen?
I think that trying to think where that might have been. I think the quite a lot of planning went in originally, as I mentioned earlier, in the context of the flu pandemic, to areas like the management of more deaths than might have been anticipated. So the role of the local authority, the local resilience forum, central government, funeral directors and others, that was worked out beforehand. I'm not sure where I think that there's been the, and I don't want to appear complacent at all, but I'm not sure where any uncertainty may have arisen. I think the uncertainties that may have been generated go back, I think, to some of the earlier questions, with people asking, well, if the Mayor of London says this, but central government says that, which is right? So I think it's been more a fact of different views from different people in different parts of the United Kingdom, rather than a lack of clarity about who's delivering what. But as I say, we're not complacent, and if there are examples that people want to bring to me, then we will respond.
Mr. Gove, just intervening on that point, you mentioned in answer to Mr. Stevenson that the Civil Contingencies Secretariat has good relationships. Good relationships are all very well, but at a time of national emergency, what teeth does that Secretariat have?
Well, the Coronavirus Act, of course, gives central government powers, but the Civil Contingency Secretariat is, as much as anything, about collating and sharing information and then drawing up plans so that central government and others can be in a strong position. It's also the case as well that, as well as the Civil Contingency Secretariat being part of the sort of broader resilience community that includes local resilience forums, that military planners have been dispatched to every local resilience forum to help them with their delivery of particular services.
Thank you. And are those military planners able to cut through the bureaucracy? Is that why they've been sent there?
Yes.
Thank you. Lloyd Russell-Moyle.
Thank you very much. The local resilience forums have been used, which are actually outlined in the Civil Contingencies Act, but of course we have not followed the Civil Contingencies Act in some of the other areas, and followed a new act, which is understandable. The local resilience forums are mapped on policing areas rather than, say, local health strategic partnership areas or wider partnerships of CCGs. Now, luckily in Sussex, that is coterminous for us. But I wonder, is there any thinking about whether, particularly in the future, but considering what we now know, whether those areas were the right coterminous areas to use? And secondly, in terms of the makeup of the local resilience forums, it is of civil service leaders rather than elected politicians, which makes perfect sense when you've got a short-term crisis. Aeroplane crash, for example, when we last used the Sussex Resilience Forum. But actually, does there need to be some thinking, particularly when these crises go on for longer, about including local politicians? And I don't just mean directly elected mayors, but I mean leaders of councils in some of those deliberations?
Well, I think those are very good points. I think the first point about the geography and the fact that they're coterminous with policing areas flows from the fact that local resilience fora will often rely on the blue light services, police, fire and rescue, and of course ambulance as well when dealing with particular issues. But of course, when, as we all hope, the effect of the pandemic has subsided, I'm sure one of the things that we'll all want to do is to look at the architecture of local resilience forums to make sure that we've got things right. And I think you're also right as well, that we do need to continually think hard about making sure that we involve local politicians and not just metro mayors. And that's managed through MHCLG, and MHCLG ministers are always very sensitive to the needs of people in local government. But I think those are two very good areas for reflection for the future. Because as is so often the case when you're dealing with a crisis, you just need to crack on with dealing with the immediate, as you point out, but then you can learn certain things from it about how best to prepare for the future.
Did local resilience forums have enough autonomy to hit the ground running, particularly in things like buying PPE? I know my one said at the beginning they weren't sure whether they had the mandate to go out and just get the stuff that was needed, or whether their mandate was to coordinate. Is there a role in giving them a more a clearer, more robust mandate to actually do things rather than just to coordinate things?
Yes, I think that's again a very fair point. And some local resilience fora, and indeed some other arms of government, like the prison service, went out there early in order to secure their own supplies of PPE. There's been a broader problem, as we all know, with PPE globally, and we can discuss some of the challenges there.
Come back to that in a bit, yes, yeah.
But I think you are right that encouraging people who are professionals to exercise their own initiative, I think, is a good thing. Absolutely.
Thank you.
Thank you, Karen Smith, followed by David Jones, please.
Thank you. And following on those points, and I declare my bias, I was an emergency planner at the NHS in 2014, and I think I'm a bit surprised to hear you say, Mr. Gove, that you're not really aware of some of those local versus national issues. We picked this up last week, the difference between strategic planning and operational planning locally, because the different ways in which the different bodies have had to access, for example, PPE, surely does stem from disclarity locally within local resilience forums and what exists on the ground.
Well, I would hope that we weren't complacent in government, and we're always determined to learn from any examples of areas where people on the front line feel that they haven't been getting the support that they need. Just to take one step back on the PPE question, we had a big national stockpile of PPE to deal with the flu pandemic. As I mentioned very briefly earlier, we had to revise our approach because of the emerging nature and the new science that gave us a better understanding of how coronavirus itself affected people. And we're also considering at this moment what the best scientific advice is for the sorts of PPE that might be required for people who are not in health or social care settings. And we touched on that obviously when David Mundell and I were discussing face coverings.
My point really isn't on this that the government's been complacent. My point really is the disconnect between the operational planning in a local area, be that what was a strategic health authority before the Health and Social Care Act, or the local resilience forums, and the responsibility of Public Health England, particularly within that, and local government. And the learning from that has been known over the last few years. And you say you're learning as government, but how have you learned from the way that local resilience forums have been operating in the last 2 or 3 years to inform this pandemic?
Well, as you will know, local resilience fora have had to deal with some real challenges, particularly but not exclusively flooding events. It's also the case that local resilience fora were very deeply involved in the preparation for what might have occurred if we'd left the European Union without a deal, and some of the challenges that that might have thrown up. And the conversation that local resilience fora and their leaders have with the Civil Contingency Secretariat has informed our approach to the Civil Contingency Secretariat, has often updated me on areas where they think, on the basis of their conversations with people at the front line locally, that central government's expectations need to be recalibrated.
Thank you.
Thank you. David Jones, and then followed for a new topic by Ronnie Cowan. David, please.
Yes, briefly, what is the line of reporting for local resilience fora in Wales, given that they comprise both devolved and non-devolved entities? Do they report by the Welsh Government, or do they report directly to Whitehall?
Principally to the Welsh Government, but it is the case, and it's the same with the different resilience model in Scotland. But it is the case, of course, that the Civil Contingency Secretariat and the Cabinet Office has relationships with people involved in the work of resilience across the whole United Kingdom.
So there's a direct relationship there?
Yes.
Thank you.
Thank you. Ronnie Cowan, and then it'll be Rachel Hopkins. Ronnie.
Yeah, thanks very much, Chair. Short questions here, because we're already up against the clock here. But I'm really curious, what was the need for the Coronavirus Act when we already had the Civil Contingencies Act in place?
Two things. The Civil Contingencies Act is designed to be used for something that is unforeseen. It's designed to be used in a range of situations where there is no time for preparation and forethought. The Coronavirus Act grew out of some of the, I hate the word learnings, but you know what I mean, some of the learnings from the exercise Cygnus operation. The fact that we were able to introduce the legislation so quickly was as a result of having thought through what might be required in a pandemic.
But there's a problem with scrutiny, is there not?
I don't
The Civil Contingencies Act would be there for scrutiny. The Coronavirus Act isn't.
Well, it's up to Parliament to have any debates that it likes on the Coronavirus Act, and it's also therefore there are appropriate staging posts which are in the legislation for review.
But by using primary legislation meant powers come into force sometime after they could have under the CCA. Did the government consider introducing short-term regulations under the CCA and then allowing Parliament more time to consider the primary legislation?
We did consider whether or not the CCA was appropriate. There is a risk, the rule of law applies throughout, that actually using the CCA would have been and could have been challenged on the basis that its use was inappropriate in circumstances where some of the requirements for dealing with the coronavirus were foreseen in advance.
Let's intervene on that, Ronnie, forgive me.
Sure.
The Civil Contingencies Act exists for contingencies. If this isn't an occasion at which that would be necessary, when would be?
Well, the sorts of things that would be totally unexpected. For example, if the country were to face, and one wouldn't want to get into lurid speculation, a military attack, for example.
But the Civil Contingencies Act doesn't just exist for a preemptive nuclear strike on this country, does it?
No, but its powers, or the powers upon which it confers upon government, are sweeping, and it is specifically, and this was the clear advice, specifically designed to be used when you have an unexpected bolt from the blue, rather than when you have something which is, as we saw, a developing threat. And the legislation was in place in order to ensure that the government was able to respond appropriately. We could have a discussion about whether or not the government has done everything right, but in terms of the legislative easements required, no one, to my knowledge, has said that there is anything that we should be doing which we don't have the legal power to do. So the Coronavirus Act was, I think, the legally appropriate thing to do. And the use of the Civil Contingencies Act, as I say, would have been open to challenge because it's not a bolt from the blue.
But it does cover epidemics, does it not?
It can be used in a variety of different areas, but it is the case that the specific requirements of the Civil Contingencies Act would have meant that if we'd used that, we would have been open to challenge.
So this epidemic wasn't quick enough. Is that basically what we're saying for why we didn't use that act?
No, I think it's the case that actually the Coronavirus Act has the legislative easements that you need to deal with a pandemic. The fact that we were able to bring it onto the statute book so quickly is because the Department of Health had used the evidence and the wisdom and the experience gleaned from thinking about pandemic threats in the past to have legislation which was prepared and which could be tweaked.
Would you be willing to share that legal advice, Mr. Gove, that determined the Coronavirus Act was necessary?
We never share legal advice.
Thank you. Mr. Cowan, sorry to interrupt you.
No, that's absolutely fine. I'm staggered to hear, actually, that this was not a bolt out of the blue. You know, given the speed at which this virus has ripped through the United Kingdom, has killed over 20,000 people, we're saying we weren't surprised by this. If we weren't surprised by it, why were we not better prepared? My real concern here is the scrutiny which the government does or does not allow itself to be put under in these times. The Civil Contingencies Act regulations have to be renewed every 30 days and can be annulled or amended through a resolution of the Commons and the Lords. The lockdown regulations were made under the Public Health Control of Disease Act 1984, which contains far less stringent scrutiny. And surely you can understand why, at a time like this, people want to hold the government up to scrutiny.
I do, but I'm sorry that you're at variance with your colleagues in the Scottish Government, because the Coronavirus Act was agreed across all 4 nations, and the Scottish Government ministers, like Welsh Government ministers, thought it was the right thing to do. But of course, we're open to scrutiny at every point. If there's any example of either the UK government or any other government abusing its powers under this act, please do bring them to my attention. Otherwise, some people might think that this was a synthetic display of anger from someone who was at variance with politicians from their own party who actually exercised executive power.
Sorry, are you accusing me of a synthetic display of anger?
Some people.
Gentlemen, as chair, if I could intervene and insist that we'll have no synthetic displays of anger whatsoever, only genuine ones, please. And on that note, perhaps, if Mr. Cowan, you finish, if I could ask Rachel Hopkins to join us.
Thank you, Chair. Mr. Gove, the National Risk Register should be produced by the Cabinet Office every 2 years. Where is the 2019 version, and how much variation was there from the 2017 version?
Well, the National Risk Register, you're right, is published as a result of the work that's undertaken by the Civil Contingencies Secretariat. In terms of variation between 2017 and 2019, I can't give you chapter and verse on that, but the National Risk Register, as I say, is a publicly available document which reflects the broader work that is done, which the Cabinet Office necessarily keeps confidential.
So is the 2019
I do beg your pardon, Rachel. I saw a copy of it in the Observer, Mr. Gove. Is that the public domain where this document is?
It was the case. I can't remember completely whether it was the Guardian or the Observer, but at the weekend, either one of them had details from a leaked document. Again, governments don't tend to comment on leaked documents, but one of the points there is that the National Risk Register is the public version of the sort of edited version of a broader document. That broader document is the government's own manual for dealing with a range of risks. By definition, you would quite rightly want to share with the public what some of the risks are that we are seeking to mitigate, but you wouldn't want to publish every aspect of your attempt to deal with risks, because there are bad actors out there, whether state actors or non-state actors, who, if you laid bare the nature of your resilience planning, might be able to exploit it to their own advantage.
Quite, and Rachel, do forgive me for interrupting at this juncture, but Mr. Gove, where therefore is that executive summary that you allude to? I can't find it in the public domain. That
is the National Risk Register, which is shared in the public domain, yes.
Rachel?
Great, so it can be shared with us then. So reflecting on the risk register, and it was assessed that the risk of a flu pandemic to be the most likely, the most disruptive crisis facing the UK, but deemed the threat of other pandemics less serious. So how different has the response to COVID-19 needed to be from the planned response for a flu pandemic?
It's a very important point. There are significant areas of overlap. As we mentioned earlier, many of the items that we stockpiled in order to deal with any potential flu pandemic have been of critical use in dealing with the coronavirus pandemic. But the nature of the coronavirus is different from seasonal flu. And as a result, it's required, in some cases, additional elements of PPE. I mentioned briefly earlier that the government scientific advisory group NERVTAG has specified what those additional requirements would be. But many of the things that one would prepare for in a flu pandemic, for example, the legislation that we've just been discussing and the plan to move non-essential cases out of hospitals in order to free up capacity, those would be the same whether it were a flu pandemic or obviously in response to the coronavirus pandemic. But because it's a new virus, we're learning, all of us in real time, about the specific symptoms and the specific responses required. And we're also learning that there are some treatments which work or might work against flu, which won't work against corona.
So reflecting on what you've just said, at what point did the government deviate away from a flu pandemic response?
Well, we responded on the basis of the scientific advice as we discovered more about the nature of this virus. So to go back to the example of NERVTAG, their advice, as they knew more about this particular disease, allowed us to refine the approach that we were taking towards advice on PPE, for example.
And the risk register emphasised the availability of PPE for first responders. But how is it not foreseen that in a global pandemic, global supplies of PPE would be in short supply?
Well, I think we had stocks for dealing with a pandemic, a flu pandemic, but the nature of this particular virus has meant that there's been a need for additional PPE that wouldn't necessarily have been the case in a standard flu pandemic. And you are right, there's been a global demand for it. One of the things that many of us will reflect on is whether or not the sources of supply for PPE are too concentrated in a geographically limited number of countries. And that is definitely a lesson to be learned.
Can I just have one more question on the risk register and how any embedded assessment of equalities was considered in the risk register? And I reflect on this pandemic having particular issues for older people, and as we're beginning to see people from BAME backgrounds.
Well, it is the case that all of the work of the government is done through the prism of equalities, and the Equalities Act places responsibilities on all ministers to think about those things. And you are right that there is emerging evidence that the virus has a particular impact on people from Black and minority ethnic backgrounds. We don't know what the full epidemiological lessons are to be learned, but the leading indicators are worrying in that area, and that's why the government has commissioned extra scientific work into this, and also asked Trevor Phillips to look at some of the questions that the emerging evidence raises.
So on the risk register that you say is published, that we will be able to see, we will see explicit equalities impact assessment of some of those risks as well.
I think there's a difference between equalities impact assessments that are carried out before certain policies are instituted or before certain bills are introduced, and that looking at things through an equality lens overall. But one of the things that we didn't know about the coronavirus and has only become apparent is, as I say, the evidence which you quite rightly alluded to about what appears to be its disproportionate impact on minority communities. But I just want to stress that while it is a worry and we are responding to it, it's difficult to make hard and fast conclusions about the nature of the variable impact of the virus, because we are still learning about it. We know that, for example, it tends to be more lethal amongst people who have certain comorbidities, and that tends to be, as you know, diabetes, heart disease, and so on. So it's looking at all of this evidence and seeing what the real risk factors are and which vulnerable communities are particularly in need of support.
Okay.
Thank you. Karen Smith, please.
Thank you. Did the Cabinet Office monitor whether various departments and agencies actually completed the mitigations in that risk register?
Well, it is the case that we do, depending on what the government department responsible, seek to ensure that government departments do have plans which are ready to deal with the threats that have been identified. So, for example, it is the case that BEIS develops plans if there is any interruption to the operation of the national grid, that DEFRA prepare plans in the event of either an animal disease outbreak that threatens the food supply, and so on. So it's the responsibility of government departments to do that. And one of the things that we seek to do is to make sure that those plans are as robust as possible and renewed or refreshed in the face of a different assessment of threats.
So you, as the Cabinet Office in your coordinating role, did assess if those departments had fulfilled those mitigations in their risk registers?
It is our responsibility to do that, yes.
Good. If I can just pan back to the unexpected nature of this particular virus, I accept that we are learning all the time, but Public Health England, in its pandemic flu strategic framework in 2014, some 6 years ago now, had a key principle of firstly preparing for the worst. It also, in its planning assumptions, recognised that a novel virus would hit the UK very quickly and that a vaccine wouldn't be available for up to 6 months. So much of this has been known within the community for some time. This is not as unexpected, the way that this virus would react, as I think perhaps you are indicating. So what lessons have you been learning from those organisations, from the risk register over the last 5 years?
Well, I think I'd say two things. One of the things is that we identified learning, I hate that word, sorry, identified evidence from both how a SARS-style virus had operated and also from what a global flu pandemic might do. And the evidence certainly from previous SARS outbreaks reflected the fact that the instance of them and the lethality of them in the UK and in Europe was less than a flu pandemic might be. That's on the basis of the evidence that we had. We're now revising that, of course, because of the nature of this outbreak. And as you quite rightly acknowledge, it's a novel virus that combines the lethality of, to a greater extent actually than before, of coronaviruses, and the ease of infection and spread of seasonal flu. So it poses a unique set of threats, and we are like everyone, seeking to find out which treatments might be appropriate in order to ensure that those who are infected don't develop the worst form of the disease. And also, as you say, seeking to develop a vaccine as well. And we're taking part in a global initiative.
But a novel virus has been long expected.
Well, one of the things that I would say is, if we look across the world, we find that every country has responded in different ways, but there's been an overlap, as I mentioned earlier, in their response. And every country, every scientist would say that it's vital to share that information and learning. But it wasn't the case that anyone anticipated precisely the type of virus that we face now.
No, but a novel virus was expected for some time.
It is the case that we have always been aware that there could be a particular threat of the kind that SARS posed, but on the evidence that we had at the time, we anticipated that it might operate in a different way.
Thank you.
Thank you. Mr. Gove, you're always very precise, and quite rightly so, in your use of language, in that you said that the Cabinet Office has the responsibility to check that different departments have robust plans for contingency. Did they do that?
I believe the Cabinet Office has. It may be that, for the sake of argument, that there is a particular threat in a particular government department where we have not been as assiduous as we might have been in assessing it. But with respect to flu, it was the case, following on from exercise Cygnus, that the National Security Council subcommittee on threats, hazards and resilience looked explicitly at the lessons to be learned and made recommendations to DHSC and other government departments about what was required. So, for the sake of argument, there might be a element of the risk register where the Cabinet Office will need to go back to the relevant department to make sure that its plans are absolutely as robust as they should be. But on all the evidence that I have of the work of the Civil Contingencies Secretariat, plans are robust and have been and are regularly reviewed.
Would you undertake to write to this committee to confirm or otherwise that in fact the Cabinet Office did undertake that responsibility properly?
Absolutely.
And you preempt me in my further question, which does regard exercise Cygnus, an exercise that is shrouded in mystery, it seems, only several references to it in local authority minutes and a board paper from NHS England. I presume that you have read the report issued following that exercise?
Yes.
So you can confirm it therefore exists?
Yes.
And would it be possible to put that in the public domain?
I don't think I can make that decision. I will talk to my colleagues. I think one of the things, again, that I would say is that the purpose of exercise Cygnus was to model a scenario for a flu pandemic. It was conducted in 2016 with a different Prime Minister. That Prime Minister then authorised, as I mentioned, the National Security Council to look at the work that was required. And it was because of that that we were able to introduce the coronavirus legislation, because of that we had a pandemic stockpile, because of that some other steps were taken by DHSC.
If not a full version, might you be able to provide a redacted version?
Let me consider that, yes. And I'd obviously want to share as much as possible with the committee. And it may well be the case that members of the committee could come into the Cabinet Office to read it, or that we could share a redacted version. I'll reflect with my colleagues on what is the right approach. One of the things, again, that you will know as a committee is that while ministers have wide discretion, I have to take account of precedent, and I'd have to ask the propriety and ethics team here in the Cabinet Office, because sometimes I'm anxious to share things, but the point is made to me that this is advice that has been offered in confidence by civil servants, and that we have to respect their duty of candour and the safe space in which advice is offered. So I'll talk to the propriety and ethics team, take their advice and write back with what I can and cannot share. But my general disposition is to share as much as possible.
When did you read it?
I read it last week.
Was it not given to you perhaps earlier on in your role? Might it not have been appropriate to receive it perhaps in January?
Some of the product that flowed from that report I had read beforehand, yes.
What aspects of the product, as you say?
The specific set of responses that had flowed from that, for example, the need for a particular set of specialist legislation, the approach that was taken by DHSC to deprioritising non-urgent operations in order to clear space, as it were. So it is the case that the Cabinet Office team run exercises all of the time, and those exercises then inform the threat assessment and the risk register that they draw up, and the work that is then done as a result. So the fact that that exercise had taken place helped us to shape and frame our response subsequently.
And in that helping to shape the response, what lessons did you and the Cabinet Office and other ministers learn from that exercise?
I think the first thing is that if it and this was a point that was made right at the very beginning, that unless you take rapid action at the right time, there is a risk of a virus, and in this case it was a flu virus, spreading at such a rate that the resources of the NHS can be overwhelmed. So the principal lessons were, A, make sure that you increase NHS capacity, particularly ICU capacity, by repurposing the way in which hospitals operate and by removing those patients who have non-urgent conditions, and also at the same time make sure that you have the legislative power or the appropriate support to bring in the social distancing and other lockdown measures required in order to stop the spread of infection. But one of the things I don't, sorry.
Thank you. What about the more practical aspects? Did the exercise reveal that there would be a lack of PPE across the health and care sector?
No, and this I think is an important point, that the exercise led to, inter alia, the development of a pandemic flu stockpile. What has caused a particular challenge is that the novel coronavirus, because it's novel, it's new, required a recalibration of our approach towards PPE, and that recalibration was recommended by NERVTAG, the scientific advisory body with particular expertise in respiratory diseases.
So in essence, you're saying that the planning for this eventuality was on the assumption that this novel coronavirus or any pandemic would be akin to an influenza pandemic, requiring a certain stock and quantity of PPE. Is that what you're saying?
Yes, because exercise Cygnus was specifically to model a response to influenza.
And was in the lessons learned, was it looking at a stockpile of actual gowns, gloves, whatever else in warehouses in this country, or was it over-reliant on securing quite complex supply chains?
It was based on making sure that we had a stockpile in this country. I should add that that stockpile was augmented as we were preparing for the potential of a no-deal Brexit outcome. But the broader point you make is one of the things that has been brought home to all of us, that when it comes to PPE, we have an over-reliance on a small group of nations to produce the bulk of the personal protective equipment required. And it's also the case that the material that is required for the best personal protective equipment, which is a byproduct of the petrochemical industry, again, the production of those raw materials tend to be concentrated in a relatively small number of countries as well.
So might not a lesson that could have been drawn from this exercise would be that those supply chains would have come under pressure and there would be an immediate need to ramp up domestic production to plug those gaps?
Well, it is the case, again, because it is a novel coronavirus, the change in the approach that we took to PPE was NERVTAG recommended, and the stockpile that we had was designed explicitly to deal with a flu pandemic. I think if you look across the globe, there is a recognition, not just with respect to PPE, but with respect to some other questions, that the future of domestic production may require greater resilience in national economies in a number of areas. There have been some people who've been warning that globalization has led to an over-concentration of production, not just of PPE, but of other things in some countries. But the dominant economic discourse has tended to be, skeptical about that. I think that that economic conversation, as you quite rightly point out, is changing.
Well, that's a rather long-term analysis. What about the here and now? What's being done in the here and now to ramp up domestic production?
Lord Dayton is leading a group within DHSC to increase domestic production of PPE. We've entered into contracts with a firm in Scotland that produces the material that is required. And what we're seeking to do is, first of all, to establish which particular sources of raw material we can access, and also, given that we have expertise in the petrochemical sector and indeed an oil and gas industry, how we can ensure that the appropriate fabric is comes on stream here. And we're also looking, as I say, Lord Dayton and Lord Agnew, at producing not just masks and gowns, but other material here in the UK. It is the case that there is some personal protection equipment whose production we've already ramped up. Not the most vital, but still vital. It is the case that distillers can produce hand sanitizer. And one of the strengths of the United Kingdom, of course, is that we've seen distilleries in Scotland change their production lines in order to produce some of the hand sanitizer that is so valuable.
Thank you, Lloyd Russell-Moyle.
Thank you very much, Mr. Gove. It's been reported that the government has received over 8,000 offers of supply for PPE. How many such offers did the government actually respond to positively in the end?
We've received 10,579 offers, and we're working through those now. Of those, there are, I think, 800 that are currently going through a process where we make sure that the offer is robust, because as you'll appreciate, as we just touched on, we want to make sure that the quality of the equipment is absolutely in line with the recommendations that Public Health England and others give in order to keep our frontline workers safe. One of the problems that we've had is that there are a number of people who've made offers, kind offers, well-intentioned offers of personal protective equipment, but they haven't been people who are capable of producing that equipment. So, for example, and I don't mean to be unfair to the people concerned, there was a company that was responsible for period costumes of the kind that dramas might require, that said we'd love to help, and they got in touch. And again, we've had to say, well, very kind, thank you. We do appreciate that everyone wants to help our NHS at this time, but it's quite a specialised sector.
I mean, was there any attempt to triage some of those smaller offers, or offers that wouldn't maybe be at standard for the NHS, but they would be able to support some of the other caring sectors in different kinds of equipment, so to make sure that they weren't just rebuffed totally?
Yes, that's a very fair point. We have obviously prioritised those who've got the biggest sources of supply and who can help the NHS and social care first. But it is also the case that we're looking at other offers where we may be able to help other areas in the public sector, and indeed beyond that as well. So yes, a triage process precisely of the kind that you outline has been done.
There were reports in the press that a number of firms came to the government early on with offers to get supplies of European certificated PPE to the standard that we know, and the government didn't respond quickly enough, and those pieces of equipment have now been lost. Are you aware of instances where the government's, and I grant you that you're never going to pick up every single thing on time, but the government lost a number of big orders, or do you not recognise that those kinds of stories?
I don't think we have. I'm always looking at how our procurement operation works, and it may well be, as we comb through every example, that there will have been a significant and generous offer that we did not respond to sufficiently quickly. So I'm not denying that it's a possibility, but one of the challenges that we face is that this is a market where, as you'll appreciate, prices have gone up, money can be made by middlemen. Often some of the people who've approached us saying, I can provide you with X or Y, are middlemen, and the ultimate source of supply is elsewhere or out of their hands. So sometimes we find that there are people who are attempting to play different markets off one against the other, and sometimes they just don't have access to it themselves. They're operating on the fly, as it were.
Yes. So, I mean, in yesterday's Daily Mail, not a newspaper that I would normally read because I find it rather revolting, but on this instance, doing something very positive, airlifting £1 million worth of PPE from China and other places to Britain, and they say they're going to do a number of those airlifts with their charity. Why is the Daily Mail able to secure £1 million worth of pieces of protective equipment? And we hear about other organisations, Liverpool, local authority, etc. But the government is saying that they are not able to secure that. And we saw over the weekend but gone, where we were waiting on this shipment from Turkey. How come private organisations are able to do it and we're not? Is there something that I'm missing here?
No, I think your question is a very fair one. The effort by the Daily Mail is wholly welcome, and I applaud it. They've done it in combination with business people, including the chief executive of Marshall Wace, Ian Wace, who is a distinguished philanthropist, and a colleague of a friend of mine, Sir Paul Marshall. It's really welcome that they've done that. However, it is the case that the amount of PPE that the UK has secured in China through the government dwarfs that of private philanthropists. And it is also the case that, without wanting to cast aspersions on anyone, that the market for PPE in China is not a completely transparent and free market as some others are. There is always, when you have transactions in China, the knowledge that the state there can intervene in particular ways.
Okay. I would be interested to know what the level of utilisation of the private sector and charitable sector has been in providing both ventilators and PPE, and what the Cabinet Office is doing to coordinate that. I mean, that's just one example, but what's the Cabinet Office doing to make sure that it is done in a holistic way, so we don't end up having the British government in a bidding war against the Daily Mail, in the bidding war against another charity, and we end up all losing out?
Well, it's a very good challenge. We have sent the Crown Commercial Service team to the Department of Health and Social Care, who are helping them to source the material required. It is the case that for a lot of PPE, China is the ultimate destination, and we have been working using our diplomatic posts and the ambassador in Beijing in order to make sure that we coordinate our sourcing effectively. But it is the case that there will be actors and players in China and in other countries who will, seek to pursue their own ends. But we do seek to coordinate that. With respect to ventilators, again, we've worked with the Department of Health and Social Care both to make sure that we are deconflicting any competing calls for ventilators, and also, of course, we've increased the capacity to produce ventilators at home. But it is a global race to secure this material. You will have seen, and no criticism of any other government, German doctors posing without clothing in order to draw attention to the lack of PPE there. It's been an issue in America and in France. I'm not trying to shuffle off responsibility by suggesting that we as a government shouldn't be doing everything we can to make the supply chain coherent and responsive. It's just to put into context the challenge that we face.
Do you think it helps to count individual gloves as separate items and individual masks even as all, to make the figures look like we are importing large numbers, which is what was reported in the Panorama and other stories? Or does that reduce public trust in thinking that our government is got a handle on this?
Again, I think that's a fair challenge. I wasn't aware beforehand, but it is the case. I was told that in the NHS that you sometimes get gloves in different sizes and different consignments. Sometimes for certain procedures and processes, you don't just need a pair of gloves, you need 4 gloves. So therefore, the number has to be precise. And I know that at first blush, you'd think, well, gloves should be counted in pairs, but that is apparently the way in which it operates. The truth is that whatever method of accounting for the delivery of products we use is perfectly open to people to criticize that and to say you shouldn't be lumping these things together.
Would it be a fairer way to record this in terms of how many days supply we have managed to acquire? So you're quite right that sometimes it requires 4 gloves, sometimes you change the apron every person, sometimes, but we know roughly what an amount of supply will last now. Would it be now better going forward to say we have secured in this shipment X numbers of days supplies for the system, rather than talking about the number of items, which, unless you are an expert in this, is probably pretty meaningless?
I do take your point. I think it is certainly worth reflecting on. One of the things that I would say is that, and I think I mentioned this briefly earlier, and I think you acknowledged it as well, that the burn rate, to use the technical term, of PPE has been greater than we'd originally anticipated. So it might be the case that we would say, on the basis of what we might have thought at the beginning or what we know now, that we have 4 days, 5 days, or 3 weeks supply of a particular item, and then we find that the as I say, the burn rate is greater, and people say, well, you told us you had 5 weeks supply, and in fact it's been up in 4 weeks. You were misleading us. And what we would not have been trying to do was to mislead, but simply adjusting to changing criteria. But I do think that your broad point, if I may, which is a greater degree of transparency on PPE sourcing and supply overall helps build confidence, is fair.
The Clipper service is meant to be rolled out. It has been delayed 3 times now, which is the service to augment some of the centralised NHS purchasing. It's of course run by Clipper Logistics. Most local authorities have now been told it will be another 2 to 4 weeks before that service is up and running. My local authority now tell me that they've given up on it ever being able to deliver. Has this been a failure in government to make sure a private service provider is actually meeting the local need?
It is something that I've been asking about during the course of today, and I want to be able to give an entirely accurate picture to this committee and to others. So what I will do is report back on, because I know that anxieties have been expressed, what the precise state of the Clipper services.
Yeah, because if people are just working around it, we get to a stage where it might be easier to scrap the logistic part of the Clipper service and just incorporate those supply lines into the supply lines now that have been established. You know, a change in 4 weeks' time might now be more disruptive. I wanted to move on to the strategy from the outset, because did the government, do you think, have a clear strategy from the outset with dealing with coronavirus?
Yes.
So the government strategy moved from mitigating the virus to very much strongly suppressing the virus. When and why was this decision taken?
It was taken on the basis of the scientific advice from the Scientific Advisory Group on Emergencies. Again, one of the points that scientific advisors have made is that if you want lockdown measures to succeed, you need to introduce them at the right point. Again, I think it's perfectly legitimate for people to say perhaps they should have been introduced earlier or not. There are some, looking at Sweden, who say actually we've introduced measures that are too restrictive. I personally think it's too soon in our response to come to a definitive view, but I'm sure that in the future people will be able to look back and make a judgment about what we or other countries did or did not get right at the right time. But the overall advice was from SAGE's experts.
And the makeup of that committee is publicly known?
Well, there are some people who have identified themselves as members of the committee. Obviously, the chief scientific advisor is. There are other people who are on the committee who have the right to anonymity. One of the reasons for that is that there have been, unfortunately, 1 or 2 threats issued to members of the committee. So again, that's one of the reasons why their identity has been protected. But I know that one of the discussions that's ongoing is the extent to which people who are on the committee can identify themselves. In the past as well, there's also been an issue with potentially some people being placed under pressure by lobbyists from sectional interests who are seeking to persuade scientific advisors to take a particular view. We wanted to make sure that they had a totally safe space in which they could have a very robust discussion. And it was felt that that was best served by protecting the identities of the majority of members. But it is something that's kept under review.
This isn't one of those committees where political advisors maybe go and give their view as well. They're all, I mean, can you give assurances that they're all qualified scientists, medical scientists and statisticians?
Yep. There was reporting earlier this week that two people from Number 10, one of whom, of course, is the Prime Minister's advisor, Dominic Cummings, attended meetings. But that is something that I would expect in the same way as when I was as Secretary of State at the Department for the Environment, I might ask the chief vet or the chief scientist in that department for their assessment of, say, the science behind the badger cull. And it was always the case that I would try to ask what I thought were appropriate questions, but I would never try to second guess the scientific expertise of the chief vet or our chief scientist. And in the same way,
is there not a problem in terms of public trust? If we don't know who's on this committee, but we do know that political advisors are going along, and of course, political advisors also helping frame the discussion. I grant you that they're saying these are the political realities. What's your advice on this? But then, very often in answers that you've given today, that the government gives generally, they say, well, we've just followed the scientific advice. Whereas in those discussions, of course, there has been a large sprinkling of political direction.
I think if it had been the case that there had been any improper attempt to influence, then it would have been the case, certainly, that someone of the integrity of the government's chief scientific advisor would have said, hold your horses there, mate. That is just not appropriate. There hasn't been any evidence of that. Indeed, I think one member of SAGE, who's publicly identified, Professor Neil Ferguson from Imperial, made the point that there was nothing improper in the questions that were being asked. I think it would be the case, for the sake of argument, again, to go back, if I had said to the chief vet or to the DEFRA chief scientific advisor, oh, go on, relax the rules on this, can't we fudge the figures and so on, they would have blown the whistle. And I think the same thing would have applied with SAGE as well.
Sorry, gentlemen, I must move on.
Can I just ask the last herd immunity question on a brief, Mr. Ragg?
Yes, you can.
Perfect. Look, herd immunity was discussed at one point, and then it seemed to be off the table at another point. Was herd immunity ever discussed with government in response to part of the strategy or not?
It was never government policy. It is a term that epidemiologists and others use to describe a particular stage in the development of a disease if a particular set of principles are followed, but it's not government policy.
The British Society of Immunology says that there is no evidence that this disease might have long-term immunity. So why were we even talking about it in a scientific way? Does that not provide confusion for the public?
No, I don't think so, because the principle, we're all, or many of us, are coming to terms with scientific debates and arguments which we weren't closely involved in before, and sometimes some of those terms can seem taken out of context, slightly worrying. And I can completely understand the public feeling on this, but it is a well understood term that epidemiologists use. Whether or not you can develop the type of collective immunity to this disease that you can to others, that is a scientific question that I'm not competent to answer.
Thank you. Thank you, Mr. Ragg.
Thank you. David Mundell, please.
Thank you, Chairman. Can I ask about issues to do with data and international comparators, Michael? Earlier this month, the BBC quoted charities suggesting that elderly people were being airbrushed out of coronavirus death figures. What's your response to that assertion?
No, I wouldn't say that. I think one of the many tragic aspects of this virus is that all the evidence shows so far that it has a disproportionate impact on our older friends and neighbours, and there are a number of comorbidities, but certainly age is a clear factor, and that is particularly distressing. We have an approach which involves us collecting data from hospitals and then from care homes and other settings. There are slightly different collection mechanisms. That's because of the way in which NHS trusts can report report death figures on a daily basis, even if the death might have occurred a day or two beforehand. Whereas the approach that's taken to reporting deaths more widely relies on people registering the death, a process that people have up to 5 days to do, and then making sure that those figures are statistically accurate. And I think Sir Ian Diamond, the national statistician, has written to the committee explaining the approach that's taken. There's always a balance between having data that is timely and data that is accurate. The more that you have a chance to kick the tires, the more you can be certain that it is robust. And data serves two purposes. If you look at, for example, the rate of infection, you can begin to form a judgment about how effective your measures have been in mitigating that process. But it's also the case that people want to know, for entirely understandable reasons, what is going on in this country. And because the data in NHS settings comes quicker, some people have said that's because the government is prioritizing that information over others and treating individuals in care homes with less sensitivity and acuity. I understand that debate, but one of the things that we all appreciate with data and information is that there has to be proper oversight in order to ensure that it's robust, and that's what the Office of National Statistics provides.
And how does that work with the devolved administrations and the figures that they're reporting, so that you can give a UK-wide figure? Because there are variations, are there not, in how these registrations are carried out in Scotland, Wales, and Northern Ireland. And it's these figures are very important. You may not be aware. I mean, in Scotland, it was announced today that in the period 20th to 26th of April, half of all deaths related to coronavirus occurred in care homes. I mean, that's a very, to me, that's a very significant statistic, which doesn't necessarily come out in the 5 o'clock briefing. It does in the Scottish one, but it doesn't in the 5 o'clock briefing. And that's a very relevant issue in a UK context as well.
Yes, I think you're right. I think that we have to respect the different ways in which the devolved NHS in Scotland and Wales and Northern Ireland operate. But one of the most important things from data is to make sure that you are within a particular country, within a particular sector, comparing like with like on a day-by-day or a week-by-week basis. Because one of the most important, but there are many, many uses to which data can be put, one of the most important uses is seeing what the trend over time might be, so that we can have confidence that the steps that we're taking are having the desired effect. But you make a very, very fair point about some of the challenges of accepting the nature of the devolved settlement.
But it's also the challenge of being able to understand the balance of the issues between care in the community, care homes, and hospitalisation, because I don't think it has been clear at some points in dealing with the coronavirus that hospitals were only part of the picture.
I do take your point, again, decisions about who should or should not be hospitalised are based, of course, on the clinical advice, and the aim is always to ensure that those with serious conditions and who face a threat to their life are in hospital. But you are right that as we look at the figures overall, we also have brought home to us the particularly lethal and vicious nature of this virus, and it reminds us of the vital importance of making sure that we support those who work in care settings.
And what responsibility do you see that the government has to ensure that ONS statistics are reported as widely as those that are used in the daily press conference, which I think you said earlier are just a selection of the statistics that you have available to you?
Well, again, my own view is that there is, as you quite rightly point out, a sensitivity towards the use of statistics, that there can be, or there might be, criticism of any government that chose to change its methodology midstream. Is it the case that we're attempting to change a methodology in order to achieve a particular outcome? So my starting point would be, this is the method that the Office of National Statistics is confident in. Let's keep that. We might want to review it later. But it is also the case, I know, that there's been a widespread feeling actually to change the nature of the statistics, how they're reported and so on. We're absolutely open-minded about that. But as I say, one of the reasons why they have been recorded in this way is I'm very sensitive to the fact that we would not want to be seen to be moving from apples to pears without people understanding, agreeing, and requiring that be necessary.
Yes, but I mean, obviously, as you accept the fact that, for example, here in Scotland, and which may be reflected in other parts of the UK, if half the people who are dying in care homes, then that does impact on the approach, surely, to the management of the disease, and is something that needs to be both in the government and public mind.
I agree.
Can I just ask you finally in this section about international comparators and how they are firstly presented? Because again, following the graphs on the 5 o'clock briefing, you see a very low number of deaths, for example, in Germany, to which usually the standard answer is, well, they measure these things differently. And what is the context in the way in which these international comparisons are presented?
Well, I think it's a very fair point. I think the best way of doing so is to do it as a per capita figure, so that we, obviously the nation with the largest number of cases, the United States, is also one of the most populous nations in the world. So the overall figure doesn't tell you as much about the spread of the disease as a per capita figure might. I think that's the first thing to say. And then the second thing to say is that different countries do use different methodologies. And there are some countries where I'm sure, I won't name them, but there are, I'm sure, 1 or 2 countries where I'm sure there is some misreporting going on. But the really, I think, powerful evidence is of trend lines, and whether or not, as we've often discussed, curves are being flattened overall. That I think is the single most important takeaway. But I'm not an expert statistician, but people like Sir Ian Diamond and David Spiegelhalter, I'm sure, would be able to provide an additional explanation of the divergence in the way in which these things are recorded. And of course, they can offer the government advice on how we can do even better.
Thank you. Briefly, Karen Smith, to be followed by Tom Randall.
Thank you, Chair. Mr. Gove, you talked earlier about one United Kingdom response, but possibly small island, separate responses. Northern Ireland, of course, is part of the island of Ireland. Will you be discussing with the Irish government coming out of lockdown and how they're going to approach it? Whether there'll be a consistent approach across the island of Ireland?
I already have. I had a conversation last week with Simon Coveney, and Simon is also regularly in touch with Brandon Lewis, and of course with parties on the ground in Northern Ireland. Again, the substance of the conversation, as you'd expect, was about the interconnection of our economies and our peoples, and making sure that we kept each other as informed and involved as possible.
Thank you.
Thank you. Tom Randall.
Thank you, Chair. Mr. Gove, I was wondering if I could ask you some questions about the reviews that happen under the coronavirus legislation. And the first one, in Section 97 of the Coronavirus Act, requires a 2-monthly report on the provisions in Part 1 of that Act. And that report the first one is due in a few weeks' time. Could you tell us who will lay that report and what Parliament should expect from it?
It will be laid, I believe, by the Department of Health and Social Care. And I will check in with Matt and the ministerial team there to give this committee an understanding of what that would involve.
Do you know what criteria the government will use to assess the appropriateness of the status of provisions as the Act requires?
I think one of the things that we will be looking at in particular, as the First Secretary of State laid out in his 5 tests, is the extent to which we've been able to reduce the reinfection rate for the virus, the so-called R number. That will be a critical determinant. And related to that is the extent to which the scientific community and others believe that the social distancing measures that we put in place have succeeded in achieving that goal.
And looking at the Health Protection Coronavirus Restrictions Regulations 2020, these are the so-called lockdown restrictions. They require review every 21 days. What role do you and the Cabinet Office play in that review?
The Cabinet Office, on the one hand, will convene and prepare the documents for the Cabinet meeting that will sign it off, and also for the COBRA meeting that will involve the devolved administrations in doing so. But the principal judgment on this will be the scientific judgment of SAGE. Obviously, it's ministers who will decide, but one of the things that we do is we make sure that SAGE are commissioned in order to make recommendations about whether or not restrictions should be eased or lifted.
And will that review involve the 5 tests that have been set out by the government?
Yes, exactly so.
Thank you. And under the Coronavirus Act, there's to be a debate in the House of Commons every 6 months on whether relevant temporary provisions in the Act should expire. Will you commit to publishing an analysis of those temporary provisions and whether they remain necessary in good time to help inform the debate in the House?
Yes, that's a good practice, and anything else I think would be disrespectful to members.
Thank you very much.
Thank you, Tom. Jackie Doyle-Price, please.
Thank you, Chair. Could I ask about moving out of lockdown, which is obviously what we're all anxious to do as soon as possible? When will the government be able to give more clarity about how and when that will come to pass?
I think in the run-up to the review date that we've just been discussing, in the run-up to May the 11th, we will be saying more about our thinking on it. One of the things, again, I don't want to criticize other governments, but one of the things that has been a challenge for France is that the president laid out a date, as it were, May the 11th as well, and then since then, the French government have come under attack for some of the things that they've said, because it's been felt that they have, by political opponents, that they haven't been thought through. The other thing in Germany is that Chancellor Merkel was on the verge of easing some restrictions, but then the way in which different regional governments responded meant that she felt, she pressed the pause button, as it were. So there's a balance to be struck between reassuring people lots of work is going on and not sending the wrong sorts of signals. But I think that most people understand that the sorts of things that any government would be thinking about would be how you can get more people back to work by having the right sorts of social distancing measures in the workplace, that people would be thinking about when and how it might be appropriate for people to return to work in schools and in childcare settings, and that it would also be the case that people would be thinking about what additional PPE might be required by people in the workplace, particularly in the public sector.
Okay, so and we discussed earlier about whether there ought to be a regional phased approach, and you make very clear that obviously people don't necessarily recognise borders in the way that perhaps we do as government. But in terms of a phased approach, can you see perhaps a more sector-based one? I mean, obviously we've got different sectors of the economy that are impacted more differently, and also where it becomes easier to implement social distancing.
Yes, I think you're absolutely right. One thing we know is that the disease spreads more easily indoors. So work out of doors. I mean, we're already obviously encouraging people to support the agriculture sector, but whether that's construction or indeed, as a number of people have outlined, sales from garden centres, it might be possible to take a differentiated approach in that way. Again, I don't want to preempt the judgment that has to be made across government. The Prime Minister's got to sign off on this, Cabinet's got to agree, but these are the sorts of common sense conversations that people are having in public. So I hope I'm not jumping the gun.
Yeah, I mean, I guess it's the importance of rolling the pitch whilst managing people's expectations and taking them with you is quite a difficult act to manage when it comes to messaging to the public.
Yeah.
But I guess one of the things about public confidence is the whole issue of PPE. Because there's a good chunk of the population that want to get out of this quickly and think actually this is all being a bit too difficult. There's also a big chunk of people who are frightened to death of coming out of lockdown too quickly. And I guess one of the things that will assure that group of people is access to PPE. Now, to what extent is that going to be a challenge in terms of moving out of lockdown?
It is something that we're giving a lot of thought to, and PPE will be necessary in some settings, not in others. And we touched on the whole face mask, face covering issue earlier. I think again, governments sometimes criticised for saying we're being guided by the science, and ultimately the buck stops with ministers. But I think people are more reassured if they see scientists and medics saying, you do need this in this setting, you don't in this setting. And that's why SAGE has been so rigorous in looking at the whole question of masks and face coverings, because it doesn't want to give people either false comfort or require equipment that isn't necessary. But you are right, I think, the British public have responded very well because the guidance has been pretty clear, and there's a responsibility on government to try to keep it clear.
And what about the supply of tests, and to what extent the availability of tests is going to inform coming out of lockdown?
Well, testing is particularly important when it comes to coming out of lockdown, because we want to have contact tracing once we've reduced the reinfection rate to the lowest possible level, and we need to have sufficient testing capacity to do that. One thing I think, it's personal view, is that Matt Hancock has done an amazing job in dramatically increasing, exponentially increasing the amount of tests and testing capacity just over the last week. But of course, it is the case that into next month, we'll be thinking about how we can increase testing even further and build up the capacity that we've already secured.
So testing, the availability of tests is going to have a big impact on when we can come out of that lockdown.
It is a factor, yes, yeah.
Yeah. Two very quick questions before other people can wind up at the end. Could you write to this committee before the end of the current 21-day lockdown period with more information about how the 5 tests will be measured and the progress to them?
I'll do my very best.
Very good. And finally, obviously we do need to sort of make a balanced judgment about public health, but also to what extent we protect the economy. And notwithstanding the very decisive measures made by the Chancellor, the longer the lockdown progresses, the more difficult it is for some businesses to come out of this. So how is the balance being managed within government in terms of how we're making those judgments?
Well, you're absolutely right. It is very finely balanced. We're putting the health of the country first, but it is, of course, the case that if the economy suffers scarring, then our capacity to fund the NHS and also if the lockdown unmitigated goes on for some time, the impact on other conditions, people's mental health and so on, does have a bearing on the health of the nation overall. So the prism through which we're looking at things is health overall, but of course the economy isn't, as you quite rightly point out, something abstract. The economy, prosperity, affects well-being and healthiness overall. So we're balancing those factors, but health comes first.
Okay, thank you, Chairman.
Thank you, Jackie. David Jones.
And just on that last point, Michael, it's been reported this morning that the 5th of the 5 tests has been diluted. The wording of the test was confidence that any adjustments to the current measures would not risk a second peak of infections. That's now been changed to confidence that any adjustments to the current measures would not risk a second peak of infections that overwhelms the NHS. Of course, a second peak of infections inevitably means a second peak of deaths. Is it the case that the government is now moving towards giving more weight to the economy than to issues such as the increase of infections?
No, I can understand the people questioning, but I think it's more by way of elucidation and clarification than anything else. The point always, right from the beginning, was to ensure that we could, as the Prime Minister said, squash the sombrero, flatten the curve, in order to prevent the NHS being overwhelmed. And so what we want to do is to make sure that there is no sombrero peak again, because we want to ensure that the NHS is not overwhelmed. It is there for everyone who needs it.
But the wording previously did tend to indicate that a second peak of infections was to be avoided at all costs. The implication is now that a second peak of infections will be tolerated, provided the NHS is not overwhelmed.
Well, again, it's a very fair challenge. I wouldn't want people to overinterpret that change. I think it's an elucidation or a clarification rather than an alteration.
So your position is completely unchanged from the original wording in essence?
In essence, yes.
Thank you. John Stevenson.
Thank you, Michael. Businesses also need to plan ahead. If they're going to get their products in the right place, involve the supply chain, contact their staff, bring them all back. So they need to plan. So they need some advance warning from the government as to when the lockdown is going to change and whether they can get back into business. They clearly also want a degree of certainty that it's not going to be a stop-start scenario. So they do have an ability to plan accordingly. Would you accept that? Would you also make sure that that is part of the government's planning? And is that something the government will do?
I completely agree. I think that's spot on. The business department are talking to employers and trade unions with precisely those concerns in mind. And again, the point about stop-start is something that the First Secretary of State and the Prime Minister have made clear, and it follows on from David's question as well, that we don't want to have a situation where the rate of reinfection reaches such a point that you have to slam on the brakes again.
Thank you.
Thank you. David Mundell.
Following up from my previous questions about the engagement with the devolved administrations, is your anticipation that there'll be a four-nation announcement in relation to the lockdown next stage, and that everyone will have come together with an agreed announcement rather than having separate announcements on different timescales? How do you envisage the managing of this piece of the intergovernmental working?
That's what I'd like to see. And before the last renewal of these measures, I talked to the First Ministers of all of the devolved administrations and the Deputy First Minister of the Northern Ireland Executive, as well as it happens with the Mayor of London, in order to make sure that we all had a shared understanding and a shared approach. And whether or not it's me or another minister who does that, we will want to do exactly the same. We'll want to be as coordinated and uniform as possible.
Thank you, David. Karen Smith.
My question is about nerve tag, but on that issue, again, the going into lockdown was really problematic for people in Northern Ireland and obviously caused some controversy. So I think it is important the government recognises coming out or moving through and announcing about what happens in Britain, also looks at what happens on the island of Ireland in both the United Kingdom and the Republic. My question is about nerve tag. In June last year, the minutes of nerve tag recommended that the gowns that needed to be purchased would fully meet infection control guidance and be body fluid repellent as a minimum standard. Can you confirm that those recommendations were achieved and implemented?
I'll have to go back and look at both the nerve tag minutes and also the DHSC procurement thereafter.
Be grateful, so you could come back to us on that.
Of course.
Thank you very much.
Thank you, Karen. And on that, Mr. Gove, there are a number of things that you've undertaken to write to the committee about. And I think if you can bear in mind that important point from Karen Smith, we'd be very grateful. Can I thank you for your time this afternoon in attending the committee in a virtual capacity? Can I also thank all members, and particularly the staff who have facilitated this meeting. It is much appreciated. Order, order.
Public administration and